Dogs and joint pain is an AP problem that has to do with blocking and some other concepts we've talked about before as well. So here's the problem. As dogs age, diminished joint and hip health may lead to joint pain and thus reduce a dog's activity level. Such a reduction in activity can lead to other health concerns such as weight gain and lethargy due to lack of exercise. A study is to be conducted to see which of two dietary supplements, glucosamine or chondroitin, is more effective in promoting joint and hip health and reducing the onset of canine osteoarthritis. Researchers will randomly select a total of 300 dogs from 10 different large veterinary practices around the country. All of the dogs are more than 6 years old and their owners have given consent to participate in the study. Changes in joint and hip health will be evaluated after 6 months of treatment. First of all, I want to remind you of something we talked about earlier. What is a control group? A control group is used to compare the change in the response variable in a group receiving a treatment to the change in the response variable in a group receiving no treatment. One of the questions asked about in this AP question was, why would a control group be useful in this study? Well, it turns out that dogs have a fairly short lifespan compared to humans. So 6 months of treatment here, 6 months in dog age, is a fairly long time. So within that 6 months period, the health of the dog and their joint pain might their joint health might deteriorate just due to aging 6 more months. And so because that joint pain might increase and we don't know how much it might increase, it would be a good idea to compare the dogs receiving one of the two treatments to dogs receiving no treatment at all. So here's how we would describe this. During the 6 months, that should be plural, joint health might worsen due to aging alone. The control group allows us to see how much the treatment helps compared to no treatment at all. So now let's talk about blocking. What kind of variability might we see in these dogs? Okay, they came from different clinics, they're different breeds, they're different sizes, they have different personalities. There's all kinds of different characteristics that these dogs have. Some may enjoy activity more. Some of them may already have a lot of joint pain, so they can't be as active. So there's all kinds of variables. But what do you think might affect joint health more than any other variable? Specifically, the question was asked in the AP exam, which of the two variables, breed of the dog or the clinic that the dog came from, because there are 10 different clinics these dogs were selected from, would be the best variable to block with? Well, the answer would be whichever variable affects the joint health the most. And okay, I'm going to kind of skip that part and jump down to at the bottom here before we come back up to that part. So let me get rid of this. And so the answer here would be to block by breed or size, since size of dog would have the most effect on the joint health of the dog. So clinic isn't going to have as much of an effect. So just to summarize the things we've learned about controlling variation in an experiment. This is known as a randomized block design. In a randomized block design, you start by separating the subjects into groups based on a similar characteristic, and then randomly assign them to treatment separately within each block. Comparison between treatments is also done separately in each block. In an experiment like this, we're still going to control all possible known variables that might affect the response variable. So maybe we can control the diet of the dogs, or we can control their veterinary care and what sort of vaccinations and sort of that sort of thing they get. But breed is not something we can control unless we only select dogs all of the same breed. So we use blocking to eliminate also a known variable, a known source of variation in the response variable that cannot be controlled in any other way by the design of the experiment. So it is a known source of variation in the response variable. We know that the size of the dog is going to cause variation in their joint health. And that's something we want to eliminate from the overall, we want to eliminate that source of variation so we can see more clearly if chondroitin versus glucosamine affects the outcome of the experiment, their joint health. Random assignment then is always essential. That distributes any unknown sources of variation randomly among the treatment groups so that each treatment group is impacted as equally as possible by any unknown variation between experimental units. The larger the group of experimental units, the better this works. So all those other unknown, those little individual variables that dogs have that other than breed, that maybe we don't even know about, maybe a genetic defect that a dog has, or how well, how happy they are with their owner and how that might affect their physical health, or all those kinds of things. All of those things that are randomly spread among the treatment groups.